Hello and welcome to the OncoAlert Weekly Roundup. I'm your host, Gil Morgan, bringing you the latest updates across oncology this past week. A reminder that these are just some of our top picks, and for a deeper look, you can subscribe to our newsletter at www.OncoAlert360.com or through the QR or link found in this post. That's www.OncoAlert360.com. Now let's dive in. Starting with lung cancer, this week the FDA approved Lurbinectedin in combination with atezolizumab or its subcutaneous form as maintenance therapy for adults with extensive stage small cell lung cancer whose disease hasn't progressed after first-line chemoimmunotherapy. The approval is based on the phase 3 IMforte Trial. This demonstrated a median overall survival of 13.2 months with the combination versus 10.6 months with atezolizumab alone, and a progression-free survival of 5.4 months versus 2.1 months. This establishes a new maintenance options for extensive stage small cell lung cancer and reinforces the role of sequential chemoimmunotherapy in this aggressive disease. And staying in the field of lung cancer and out on the Lancet Oncology, first-line immune checkpoint inhibitors with or without chemotherapy were associated with significant longer overall survival compared with BRAF and MEK inhibitors in patients with metastatic BRAFV600E-mutated non-small cell lung cancer, particularly in older patients, smokers, and those with PD-L1 expression or TP53 co-mutations. And we move on to breast cancer and news from AstraZeneca, an update from TROPION-Breast02. This news from industry reports that Datopotamab Deruxtecan is the first therapy to show an overall survival benefit in patients with locally recurrent or metastatic triple-negative breast cancer who are ineligible for immunotherapy. Meanwhile, new data out on invasive lobular carcinoma shows that it accounts for about 10% of U.S. breast cancers, with rising incidence across all racial and ethnic groups and a distinct clinical course from ductal carcinoma. And in hormone receptor positive HER2-negative metastatic breast cancer after progression on CDK4/6 inhibitors, a network meta-analysis highlights the superior efficacy of targeted combinations and novel endocrine agents, ribociclib plus ET, capivasertib plus fulvestrant, and elacestrant, underscoring the importance of biomarker-driven treatment sequencing. And in GI cancers, a Bayesian network meta-analysis found that tislelizumab plus chemotherapy delivers similar efficacy plus potentially improved safety compared to nivolumab or pembrolizumab-based regimens for HER2-negative advanced gastric and gastroesophageal junction cancer. And in biliary tract cancer, a multicenter study identified HRD, BRCA, TGF-beta pathway alterations, and high tumor mutational burden as prognostic biomarkers in patients treated with cisplatin, gemcitabine, and durvalumab, reinforcing value of molecular profiling to guide therapies in these challenging tumors. Shifting to GU cancers, and a global survey on 201 physicians highlights key considerations for enfortumab vedotin plus pembrolizumab in advanced urothelial carcinoma, emphasizing neuropathy, performance status, and tumor histology as critical factors for safe integration into routine practice. And in prostate cancer screening, MRI-based biopsy strategies, particularly as a second-stage test with targeted biopsies, improve detection of clinically significant cancers while reducing unnecessary biopsies and overdiagnosis. And finally, in gynecological oncology, stage 1A uterine carcinosarcoma without myoinvasion carries a high risk of distant recurrence with 5-year recurrence-free survival of just over 63% and overall survival of 72%, and no significant survival benefit observed from chemotherapy in this small cohort, highlighting the need for further research in this rare disease. So whether it's expanding first-line options, leveraging biomarkers for personalized therapy, or refining screening strategies, the message is clear. Oncology is increasingly data-driven, precise, and patient-centered. This wraps up this week's Roundup. I'm Gil Morgan, and you've been listening to the OncoAlert Weekly Roundup. Stay informed, stay hopeful, stay OncoAlert. We'll see you next week.